Good morning and good evening, wherever you are in the world. It's my pleasure to be with you for the next 10 or 12 minutes or thereabouts, talking to you about COVID and uncertainty and ways to care for your mental health and well-being. My name is Nicholas Procter. I'm a professor of mental health here at UniSA's Clinical and Health Sciences, and our team have been working with people who have been dealing with uncertainty brought about by COVID-19 and trying to find ways to be able to support people as health and human service workers who are impacted directly or indirectly by COVID-19. So I lead the Mental Health and Suicide Prevention Research Group. We're a multidisciplinary group. We work with people in mental distress across the lifespan, and we're a very generous group. We try very hard to share all of the resources and insights that we gain in the work that we do. So please follow us on Twitter. All of our resources are generated for policy or practice or teaching purposes. You don't need our permission to use them. They're available for you if you would like to do that. So COVID-19 has brought incredible and unprecedented changes to our life, and primarily it's about uncertainty. And so my time for the next few minutes is about how we might deal with it. Well, one of the first things to really do is acknowledge how you're feeling. Uncertain feelings are uncomfortable feelings, and uncomfortable feelings can keep you awake at night, maybe make you a little bit irritable, preoccupied, not listening to friends or spouse. Acknowledge this, be aware of how you're feeling, and perhaps even write down on a piece of paper 3 or 4 of the feelings and the changes that you notice in yourself. Because when you notice changes in yourself, it's the first step to be able to do things to make situations safer, which I'm going to come to in a moment. In times like these, in COVID times like these, it's okay not to be okay. In life, we can put a lot of pressure on ourselves to always be perfect and always be the right person at the right time in the right way. But these are not normal times. These are COVID-19 times. So it's okay not to be okay. And by beginning to think about that it's okay not to be okay, can take the pressure off us to be perfect, to be as others would expect us to be. It also takes the pressure off ourselves to always get things right. So if we're okay to not be okay, it's a lot easier for us to connect with family, loved ones, people that are important to us, and people in our support network. One of the things that COVID-19 has done is it's hijacked the very good things, the very beautiful things that humans love to do. Humans love to be with other people, in close proximity to each other. They love to kiss and embrace and be alongside, holding their family, hugging, kissing, embracing. They love to be able to do that. And COVID uses those things that humans do really, really well as a way of spreading its disease, spreading the disease. It hijacks, if you like, the very things that we do very well as humans. So we've got to find alternative ways of connecting. So connect with your circle of friends, people in your network, and that might mean using the iPhone, FaceTiming friends, using the Zoom platform, using other electronic means to connect. But if you connect, you can regulate those emotions, those times that you're not feeling okay. And when you can regulate or be able to calm those times that you're not feeling okay, it's often in contact with other human beings that becomes possible to be able to do. So do things that calm you, things that distract you, things that make your situation safer. Just think about the things that calm you, distract you, and make you feel better and safer about your situation. It might be going for a walk in your favorite park, playing table tennis, watching particular sport, some calming music, listening to music, a podcast. I'm really enjoying podcasts in these times. So use these things that you know about yourself that connect with how you're feeling to be able to move you to another feeling state, another place, to distract you, to be able to calm you. And when you do that, you're also doing things that you can control. One of the things that COVID has hijacked, as well as our way we're wired up and to be with other people, is it's hijacked how we can spread ourselves in our community, how much mobility we might have, our ability to be able to venture from home, use public transport, and a range of other things. So it's taken away things that we enjoy doing, the controls that we really enjoy doing, and sometimes that can be very overwhelming. The advice from mental health experts is to be able to focus on the things that you can control. And my message is to do things that you can control that are right for you. So these are healthy options. These are things that are good for your sleep, good for your rest, reducing your alcohol intake, reducing the use of other drugs may be also an important part of the sorts of changes that you need to make in combination with doing the things that calm you and distract you. And through all of this, go gently. My message throughout the pandemic is that don't try and do too much. This is not the time to, necessarily not the time to lose weight or to try and make other changes. You've already got a lot to do, a lot to deal with right now. So go gently on yourself, go gently with others, be patient with others, particularly older people in your network, older Australians or older family members in your network that might be using electronic communication for the first time. They're not very familiar with electronic communication, Zoom platform or FaceTime or whatever it may be. Be patient with people and setting realistic goals. So in doing the things that you want to do, set goals, give yourself a timetable, have some structure, have a plan for your day, have a plan for your week. These are all realistic things to be able to do. And many mental health experts will recommend that by breaking things down into smaller, manageable chunks, it's a lot easier to be able to achieve those things. There may also be times that you need more support, and that's okay too. So things that you can do yourself, things that you can do in collaboration, in partnership with your family or your friends may not be quite enough. So also on the screen right now, you'll see a list of services. If you click those links, services in the Asia Pacific region, the Oceania region, but also more globally for the Samaritans group. They've put together a range of other local resources and supports that you can tap into. I've had a look at those offerings and they're good. These are credible organisations that are focused and dedicated and very aware of the importance of mental health and wellbeing during these COVID-19 times. One of the things that we're also very conscious of right now is that for some people, they need to be in lockdown. They're not able to move about freely in their streets and suburbs. If that's a situation that you're in, there's some excellent advice that's become available. Do things to nurture yourself during the day. Have a special moment of something that you really love to do. It might be making a particular phone call, having something special to eat, a special piece of music, but also have something that enables you to exercise and have an exercise routine. Structure your day is another important thing that people who have been experiencing lockdown say helps them to be able to get through their day. So it's those small things that become very important and very relevant in times like these. So that's my message to you today, to be able to spend time doing the things that are right for you, to be able to spend time connected with other people, and most importantly, to be able to have a plan and do the things that you can control.